In this part, I would like to give you some resources and examples of clinical practice guidelines. And there are many nice resources you may benefit. Among them, I must mention the Guidelines International Network, GIN.net, or guidelines.ebmportal.com, run by EBSCO. The NIH Clinical Practice Guidelines from USA, and as another example, we may look at the German guidelines. This is a screenshot from the web page of the German Association of Doctors, of Scientific Doctors. And you see here the different levels of guidelines, as from S1, S2 evidence, S2 consensus, and S3, and the relevant numbers of guidelines present actually currently. This is relatively current, this screenshot, in Germany. So they have a total of 204 S3 guidelines used in Germany. Different countries have their own guidelines, but in much extent they are also similar. One of the guidelines I like you to see is this GNC, Joint National Committee guideline. The 7th report is actually not so actual anymore, but among the many reports the GNC group has developed, they even have the GNC 8. I like the GNC 7 the most. So I would like you to have a look at that. It is about prevention, detection, evaluation, and treatment of high blood pressure. So a must-to-see guideline from my perspective for all medical professionals. Here on page 26, for example, in this GNC 7 guideline, there is a table showing how much benefit you can expect from different kinds of lifestyle modifications to prevent and manage hypertension. And here you see, with weight reduction, you may achieve 5 to 20 milligram per 10 kilogram weight loss. Adopting a DASH diet, dietary adjustment to stop hypertension, could also lead to approximately 10 millimeter mercury decrease in the systolic blood pressure, and so on. So even the different medications and how much they how benefit you should expect from them is included, and which combinations are good in which different comorbidities. I like, as I said, this guideline very much, and I suggest you to have a look at it. So GNC I mentioned. Then, just as an examples, a guideline from the American Academy of Family Physicians on diabetes, and you see they recommend that adults aged 40 to 70 years who are overweight or obese, so normal weight people should not go to the doctor and ask for a blood glucose check. But if you are 40 to 70 years of age and have over some weight, additional extra weight, then you should undergo a screening. Furthermore, a very important resource of guidelines is the US Preventive Services Task Force. Worldwide, many scientists are following this group and their recommendations they have recommendations on almost every disease, important diseases, at least you can imagine. So this one is about the diabetes again, diabetes screening. And in the guideline, you see how they categorized normal hemoglobin A1C or fasting blood glucose or oral glucose tolerance test results. Level below 5.7 is regarded as normal, whereas 5.7 to 6.4 is regarded as impaired fasting glucose or impaired glucose tolerance, and a threshold of 6.5 is used to diagnose type 2 diabetes. In the guideline of American Academy of Family Physicians, you also will find the definitions of impaired fasting glucose and impaired glucose tolerance, what they are, which levels of blood glucose, fasting blood glucose or blood glucose after postprandial, after eating 2 hours after consuming glucose are used. Good.